players form a kind of a triad. And we have the professionals in human health, we have animal health professional, and we have the environmentalists, the ecologists. Sometimes we could have the law enforcement agents also playing a role, policymakers, those in agriculture, even the community dwellers, and sometimes even the animal owners. Now, what are the common One Health issues? What are those challenges that One Health approach try to handle or try to solve? One, we have the emerging and re-emerging and endemic zoonotic diseases. It also tried to handle the issue of neglected tropical disease and vector-borne disease. And for the sake of today's presentation, we'll be talking more of food safety and food security. And again, One Health also tries to address the issue of antimicrobial resistance, environmental change, and environmental and climatic change, and as well as other health threats, food, animal, and the environment. Now, for food safety and food security issue, for today, we'll be looking more closely at food safety issue. Now, food safety issue is talking about having food that are free of contamination, while food security talks about having access to food. Now, from food safety issue, we have foodborne diseases or foodborne illnesses. And these are illnesses that are caused by consumption of contaminated food or beverages. Now, these food contaminants could either be a chemical contaminant, biological contaminant, or physical contaminant. Now, for the sake of this particular webinar, we'll be looking more closely at biological webinar with microbial contaminants. A study done by Gizor in 2019, I've done the comparison of food safety issue between developed countries and developing countries. And from this chart, we could see that for us in the developing countries, microbial contamination top the chart of the food safety issue. And food safety issue is associated with foodborne diseases, and some of the food that we are talking about here, we are looking at raw poultry, raw meat, raw egg, raw beverages, and fruit. Then we will have the unpasteurized meat. This is just talking about the schematic representation of the main sources of contamination of food. We have the water, we have the environment of the animal, and as well as we have the feed. And we could see that from the environment or from the water the animal consumes, or from the environment the animal lives, they could become infected with any of these microbial contaminants, ranging from Vibrio to E. coli, Salmonella, Listeria, Bacillus, Campylobacter, and what have you. This is the kind of schematic diagram of foodborne zoonosis, how disease move from animals to man, that is zoonosis, and how it can also move back from the humans to animal. And we can see that for the zoonotic diseases, we could have waterborne disease, we could have airborne disease, we could have foodborne disease, we could have vector-borne disease. And for the sake of this webinar, we'll be looking more at foodborne zoonosis. Now, foodborne zoonosis are those that are mainly, but not exclusively, due only to the consumption of contaminated animal source food. Sorry. And again, foodborne diseases are major health problems, not only in developing countries, but also in developed world. It is not a thing of either is a developing country issue, is a cosmopolitan problem or challenge. But however, developing countries tend to suffer more from foodborne disease or illnesses challenges. WHO have reported that about 30% of people in developed worlds suffer from foodborne diseases, while in developing countries, almost about 2 million people deaths have been reported that is due to foodborne diseases. In Nigeria, over 200,000 people die annually as a result of foodborne illnesses. And the World Bank has given an estimation of the economic loss due to foodborne diseases to the tune of $110 billion. Really, that is huge. That means need to be tackled headlong. Like I displayed earlier, let's look at what are the common major foodborne zoonotic bacteria pathogens that we can encounter. From this chart, from the report of study of GIZOR 2019, we discovered.
Someone remove, sorry, sir. Can someone remove Nathaniel? Yeah, and please make my new account to host again. Thank you. All right, you can proceed now, sir. Very sorry for the short.
No problem. So microbial contamination ranked top among the various contamination that make up of food safety issues in developing countries, and Nigeria inclusive. We have many bacteria that causes food safety issue worldwide. And we are looking more closely at bacteria because bacteria constitute about the 2/3 of all human foodborne disease challenge worldwide. And among the bacteria, the leading ones are the Campylobacter, Staphylococcus salmonella, Listeria, Yersinia E. coli, and so on. These are the most common causes of foodborne zoonosis and death worldwide. Campylobacteriosis. Campylobacteriosis is caused by Campylobacter species, and Campylobacter is a true global pathogen because it's cosmopolitan. It is found everywhere, both in developed and in developing nations of the world. And Campylobacter is the leading cause of bacterial diarrhea disease worldwide. In the US, Campylobacter is a common cause of foodborne illnesses, and while in developing nations like Nigeria, human Campylobacteriosis is endemic, and it is due to Campylobacter. Campylobacter is a common cause of gastroenteritis, and it is mostly attributed to foodborne illnesses of poultry origin, as reported by Inwako et al. 2016 and Cadmos et al. 2019. Campylobacter can be found in the reproductive organ, in the intestinal tract, in the oral cavity of animals and humans. The reservoir of Campylobacter include almost all poultry, livestock, sheep, goats, cattle, camels, what have you, as well as wild animal and wild birds are known to be a reservoir of Campylobacter. Rodents have also been reported to be a reservoir of Campylobacter. Also, companion animals, cats and dogs, have also been reported to be a reservoir of Campylobacter. But especially, poultry is the most significant reservoir of Campylobacter. And most commonly, people come down with Campylobacteriosis after consumption of contaminated chicken, as the case may be. And like I said earlier, Campylobacteriosis is majorly caused by Campylobacter jejuni and followed by Campylobacter coli. Other species of Campylobacter like Concisus, Urolyticus, Hyointestinalis, Campylobacter laris, are also becoming of clinical importance. And from the chart up here is displaying the overview of sources, transmission, and outcomes, that is clinical signs or symptoms of Campylobacter infection. We can see that the primary hosts are the chicken, the poultry, the swine, and the cattle. And these animals can get infected by consumption of contaminated feed water or from their environment, and they furnish and they allow the organism to multiply in the intestinal tract of these animals. And during during slaughtering, processing, and what have you, if care is not taken, the meat or the poultry, as the case may be, may get contaminated when there is a contact between the meat and the intestinal content. That is why care must be taken during processing of animal in slaughter, that we carefully separate the intestinal and the GIT contents away from the meat. So once there is a contamination of the meat and the food is not going forward properly being handled or treated, at least about 500 cells of Campylobacter is enough to establish clinical infection in humans. And once that is done, it presents as watery diarrhea, bloody diarrhea, there could be inflammation, there could be fever, vomiting, nausea, cramps, and what have you. Now, control and prevention of Campylobacteriosis, majorly sanitation and hygiene it rank the table of prevention and control for Campylobacteriosis and for many of other foodborne illnesses. Sanitation and hygiene in livestock farm thereby tend to reduce the bacterial population in that place. And also in meat processing plant, we should pay attention to hazard analysis and control critical points. Then again, there should be proper washing, handling, and freezing of carcass after slaughtering. Then there should be improvement of food handling skills in restaurants and homes. You know, many times, many restaurants and homes, they are careless about the way they handle the food in preparation. So how people at homes, at restaurants, food vendors, street vendors, how they handle food, they should maintain high level of hygiene. If not, they will keep furnishing these foodborne pathogens into the society. But security measures and personal hygiene should be taken very seriously if you are to control Campylobacteriosis and other foodborne illnesses. Also, the utilization of something like essential oils, prebiotics, probiotics, bacteriocins, and immunization can also go a long way to control and prevent Campylobacteriosis in humans. Let's talk a little about local risk factors for the spread of foodborne zoonoses. And I put up here consumption of unsafe food. When you consume food that are not well prepared, or food that have been contaminated, or food that have not been stored very well. So eating unsafe food can predispose to foodborne zoonoses. Again, we have improper time and temperature. When you don't allow enough time between cooking and refrigeration, or when you allow too much time between cooking and refrigeration, or when you refrigerate food improperly, this could also lead to the spread of foodborne zoonoses. Inadequate cooking, at least all food should be cooked at a temperature of nothing less than 70 degrees Celsius, so as to ensure, please excuse me. Sorry, please. We should cook food at nothing less than 70 degrees Celsius so as to ensure proper destruction of the pathogens. The poor personal hygiene can also lead to spread of foodborne zoonoses. Using of contaminated equipment. Many times you see people using the same knife to prepare raw food or raw meat or raw chicken, and still use the same raw food unwashed to either cut cooked food. All these habits can increase or facilitate the spread of foodborne zoonosis in the community. Biosecurity in food animals. Now, as we said earlier, that food is vital to the spread of foodborne zoonosis. Food is key, is vital, because many of the zoonotic diseases that we have, they are actually related to food animals in one way or the other. And thereby, the way these animals are produced, the way these animals are farmed, need to be looked into critically, and thereby trying to prevent this animal from getting infected with any of these zoonotic pathogens that can get to human eventually. Now, biosecurities, as we all know, are a set of preventive measures designed to reduce the risk of infectious disease transmission within and across farm. Now, in biosecurity, you are not only preventing pathogen coming to your farm, as well as you are trying to prevent, if your farm is infected, there is an established infection on your farm, you're also trying not to spread that infection out of your farm to other farms. And according to More 2023, a 3-level of biosecurity has been identified, and I want to quickly discuss that in this discussion. The first one is conceptual biosecurity, followed by structural biosecurity, and followed by operational biosecurity. Now, many times, many farmers or many animal producers lay more emphasis on operational biosecurity while they neglect structural and conceptual. But these are also very, very critical. I know that my guy will always tell me something in poultry production farm, that there is little you can do when you have heat stress in poultry. If your poultry pen is not well constructed, you know, there's little or nothing you can do about that at that particular point. So, but these are the things you could have prevented at the conception and structural level of biosecurity. Now, at conceptual biosecurity level, this is also known as the primary biosecurity level, and it talks about the location of farm. We all know that to prevent or to maintain good biosecurity, to prevent animals from getting infected with pathogens, we need to locate or site animal farm appropriately. You don't locate animal farm close to other farms. You don't locate animal farm close to main road. You don't locate animal farm close to dumping site. You don't locate animal farm close to abattoir or to effluent from abattoir. So all these things need to be looked into while siting a farm, so that you can take care of biosecurity at that level. Also, structural biosecurity talks about the whole layout of your farm. How is your farm layout? Where will the visitor stay? Where is the sick bay? You know, if you are dealing with a multi-species farming, the layout should be in such a way that it makes provisions for different species of animal. You don't mix different species of animals together, and that has to be handled at the structural biosecurity level. This was talking about the height of the farm, or the height of the fence, or the height of the roofing and what have you. So this will be taken care of at the structural biosecurity level. Many of the time, farmers and many animal producers, I know they play down on these 2 levels of biosecurity, and they focus more on operational. And many times there are errors at the conception and at the structure of farms, and there is little you can do at operational level to stem infection or to boost biosecurity. Nevertheless, operational biosecurity talks about day-to-day activities on a farm, what you do, what you don't do, so as not to bring infection to your farm and not to take infection from your farm to other farms. Of course, this includes having one exit and one entry, and something like having different clothing that you use in the pen and those that you use outside the pen, having the foot deep, having a driveway bath with disinfectant that come into your farms, you disinfect them, and also okay. Now let's look at what are the pragmatic and inclusive ways to prevent foodborne zoonoses in typical tropical communities, the one health approach. Now, human-animal ecosystem is an interface, and it is very important in the safeguarding of public health. Now, like we said earlier, One Health approach talks about identifying or recognizing the fact that the health of animal, humans, and even the ecosystem, they are interrelated. And for humans to be in good health, animal and the environment must also be in good health, because there is an interconnection among these three. Now, WHO, World Organization for Animal Health, and FAO in 2011 have to come to an agreement that there must be a collaboration between these three different sectors, and that has led to establishment of one health initiative worldwide. Now, collaboration and the coordination under the One Health concept can help to improve prevention and control of foodborne zoonoses. It can help to better monitor of disease threats and can help to better care for the health of livestock and environments they are raised in. Prevention of foodborne zoonoses starts from the farm to the table. That is, it starts from the farm where the animals are produced to the table where the products are consumed. So along the line, the prevention of foodborne zoonoses is a continuous thing. Don't say that because you have raised your animal very well at the farm, you now let loose of your guard in the products of in the production line of production chain. No. Beginning from the farm, all through transportation of the animal to the abattoir, slaughtering, processing, storage, selling, cooking, we have to make sure that we prevent foodborne zoonoses all the way long. Poultry meat is significant to Campylobacteriosis infection, as we said earlier. Now, during slaughter, the carcass of the animals can become contaminated with Campylobacter organism from the intestinal content of either the chicken, the swine, or the cattle, as the case may be. Now, subsequently, human Campylobacteriosis can arise from consumption of contaminated products that have not been treated properly. Now, let's look at the One Health approach to the prevention of foodborne zoonosis disease at the community level. Now, at the farm where the livestock are raised, what do we need to do? Who take charge there? Now, veterinarians take charge at the farm level where the livestock are produced, where the poultry are produced. Then at the farm, veterinarians should make sure that they conduct surveillance, they make sure that they prevent and control animal diseases. And again, very important, there must be a good antibiotic stewardship. There must be a good antibiotic stewardship at the farm level. We don't abuse antibiotic, we don't overuse, we don't underuse, we don't underdose, and we don't overdose. Also, during transportation, then at the abattoir, what do we need to do? Now, here, both environmentalists and veterinarians take charge here. Now, during transportation, to also safeguard the health of the animal vis-a-vis trying to prevent contamination of foodborne pathogens, animal must be transported in a very humane manner. You know, you don't overcrowd the animal in transit. If the distance is very long, you have to rest them periodically, you water them, and you feed them all the week. Then when they get to the abattoir, before slaughter, the animal should be well rested. If not, they're going to come down with the issue of DFD or PSE. Now, animals should be well rested and they should be allowed to recover from the stress of the journey. And at the lairage before slaughtering, antemortem inspection should be conducted. The level at which some infection, if present, could be detected, the animal could be sent for treatment, or the animal could be excluded from slaughtering, as the case may be. Now, any animal that passed antemortem examination will be sent in for slaughtering, and the slaughtering should be done humanely the issue of which slaughtering method to go for, either we stun the animal or we don't stun the animal, is still subject to debate based on belief differences. In any case, when animals are slaughtered, they should be allowed to bleed. You should allow enough blood to bleed out of the animal, and that is why it is most advisable that when slaughtering animal, the animal should be slaughtered on hoist. That will allow more blood to drain by gravity, because blood is not edible part of meat. Now, after slaughtering, there should be a post-mortem examination that is also called meat inspection. And at this level, some of the infections that cannot be identified at the ante-mortem inspection level can be identified at meat inspection or at post-mortem examination stage. And this is very, very critical. We've seen people that they've seen lungs full of tubercles, and they are happy that the lung has a, what do you call, and they even said that to the public. So at this level of postmortem examination, some of these are infections that are zoonotic, TB in particular, and other diseases can be cited, and the carcass can be sent for either partial or total condemnation, as the case may be. And again, the last stage here talks about refrigeration. That is where the carcass will be chilled. You can either go for rapid chilling or slow chilling, as the case may be. In any case, chilling or cold storage is very, very important, so that we can prevent, or we can reduce or halt completely the multiplication of any pathogen that might still be left on that particular carcass. Now, for food handlers and for consumers, at the community level, what do we need to do so that we can also help them or help the community in holistically preventing foodborne zoonosis? Here, we need human health practitioners here. Now, we've seen the involvement of veterinarians at the farm level and at the abattoir level. Now, for at this stage, human health professional plays more role here. What I mean is that human health professional will help us to interpret clinical symptoms, to establish for proper diagnosis, and to also help us differentiate the infection or the diseases at hand from other illnesses. Is it a real foodborne disease, or is it a foodborne allergy? Is it intoxication, or is it poisoning? So human health professional, we have to come into play in this at this stage. Also, human health professionals are very strategic to food safety education of the populace. Many times, community health officers or epidemiologists take the stage here in trying to educate the public on how to maintain food safety. And certain group of people have been recognized to be very important, to be very key, talking about food safety issue in our community. And the first of them are the domestic food handlers. And this includes those that prepare food at home for the families, especially nursing mothers and caring mothers. You know, those that prepare food at home, they are critical to foodborne issues to anyone in that particular family, and their education on how to better handle the food so that they prevent contamination of that food going forward will go a long way to help in the prevention of foodborne zoonosis at the community level. Also, professional food handlers. This talk about street food vendors. This talk about caterers. This talk about those that are working in food processing industries. You know, they are very critical, because if you look at all these group of people, they contact or they deal with a much more larger number of people. A woman selling food on the street, you know, Tom, Dick, and Harry come buy food from her or him and go. So they have a link with a whole lot of people, and thereby their activity will go a long way to affect the public health issue as far as the foodborne disease is concerned. So the education of this group of people on how to better handle food while processing, while cooking, and while presenting it matters. And our health professional, community health professional, epidemiologists will help in handling such education. And the last group of people here that we talked about are the people of high risk group. We know that the children due to their age, the immune system is still not very mature. While for the elderly, as the age, the immune system become weakened. The pregnant women, hormonal changes and hormonal imbalances could have a negative effect on the immune system. And those with immunocompromised situation, the HIV patients, the COVID-19 patients, hepatitis patients, these are individuals with immunocompromised, people that their immune is already compromised due to the underlying disease they are going through. And again, travelers, travelers in particular to new environment are also at high risk of contracting foodborne disease because many times they are exposed to new type of food, they are exposed to new environments, stress of journey and what have you, make their immune system wane. Food safety education must be targeted. Let me say, for food safety education to be successful, it must be targeted towards behavior that are linked with foodborne illnesses. So when we are giving food safety education, it should be targeted at those behaviors that we do or that people do or that people exhibit that can affect food safety of the community. And WHO have given us 5 keys to safer food as we have on this slide. And the first of it is for us to keep clean. Cleanliness at all stages of food production, processing, handling, and preparation, even to the table, we should keep clean. And we see here that the health officer, the clinicians, will help in educating the community on how to keep clean, constantly wash your hands with detergent, with warm water, you blow your nose, you use the toilet, you shake hand, you use the doorknob or whatever, you wash your hand properly every time, even moving between food, moving between raw food and cooked food, there is need for individual to wash and wash all content that the food come into contact with, the kitchen table, trays, knives, what have you. So we have to make sure that we keep clean all through. Number 2, talking about separating raw food from cooked food. A study done in Port Harcourt by researchers have identified that many people are not so keen about taking care on how they separate cooked food from raw food. Don't forget that many times, many livestock and poultry are infected with some of these pathogens on the farm, and while processing them, the pathogen remains in the GIT. And sometimes when you process food, raw food, uncooked food with a particular utensils, you should not use that same utensils unwashed to also handle. So all along food production, processing, and handling, we should separate cooked food from raw food so that we can prevent cross-contamination of a foodborne pathogen. Now, food should be cooked thoroughly. Thorough cooking of food, like I said earlier, at least above 70 degrees Celsius, we enable destruction of most of these pathogens. Number 4 key is that we have to keep food at safe temperature. Food that are meant to be eaten immediately should be kept at least at 60 degrees Celsius and above. So if you are not going to eat food immediately, then they need to be refrigerated at below 5 degrees Celsius. Now, when refrigerating food, it is not advisable that you refrigerate large lump or large sum or large amount of food at once. It's good that you break them into pieces, because if you refrigerate large sum of food at the go, the dropping in temperature sometimes may not get to the core of that food, and leaving the core of that food with a warm temperature and which form a microclimate for the multiplication of pathogen going forward. And again, you must use safe water and safe materials to handle and to prepare your food. Now, for the ecologist or for the environmentalist, how do they come in? What is their own role in the One Health approach to preventing foodborne disease or zoonosis in the community? A researcher called Musoke et al. Identified that environmental health practitioners contribute to One Health approach in one of these ways. One, environmentalists, they help in the destruction of condemned carcass. They also help disease surveillance. They help in outbreak investigation. They also help in control of zoonosis, the control vectors and vermin, and they can also help in health education of the populace or the public. Again, they play a major role in the prevention, detection, and abatement of pollution, be it microbial pollution, chemical pollution, physical pollution of either the water, the land, or the air. So environmentalists or the ecologists will come into play at that level, contributing their quota to the One Health approach of preventing foodborne zoonosis. Again, they conduct house-to-house inspection, house-to-house inspection of water, of sanitation, of hygiene, and what have you. I remember while I was still much more younger back at home, we normally have people that we call the environmental. You know, they come to your house, check your water, check your kitchen, check your gutter, and check your toilet and what have you. But over time, this has waned, maybe due to challenges in the country. But these are the things we need to do, that our environmentalists need to do, so that we can keep people at their toes and so that they can maintain good hygiene in their houses. And again, environmentalists also help in the enforcement of public health legislation. You know, many times some of this legislation that has to do with foodborne prevention or disease prevention, when there is no enforcement, people tend to begin to break them, and you and I can guess what the result will look like. Now, for tonight, I want to conclude by saying that many cases of foodborne diseases occur because of basic errors in food preparation, either in the restaurant or at home. At community level, good personal and food hygiene, as well as food safety education, can abate many foodborne diseases. The WHO 5 keys to safer food, they are easily comprehensible, can be done, can be understood, can be applied by anybody, and all community dwellers should be encouraged to follow it at all times so that we can safeguard our health and we can have eliminate food safety issues. And again, there is need for collaboration going forward and cooperation between multiple disciplines, multiple sectors, so that we can provide safe food for the community. These are some of my references used for this presentation. Thank you for listening.
Oh my God. Wow. You wouldn't expect less from an associate professor for that matter. That was exciting. There was too much to learn. Yeah, I mean, you would all agree with me, there was too much to learn. But I believe everybody picked one or two lessons. Imaunki, I would like to start by expressing the particular points that I actually picked from these, so that you also, recap a bit and buttress the points you learned and what role you think is yours and the ones you want to play moving forward. So to start with, I would like to mention the fact that biosecurity, according to his presentation, is very important. The importance of biosecurity at the farm level, at the community level, cannot be overemphasized, right? For veterinarians or human health professionals and environmentalists, we all have a role to play in enforcing biosecurity at the community level to prevent or to break the chain of the transmission of foodborne zoonoses. Then, secondly, you mentioned specifically under the rules of human health professionals that education for target groups of food handlers, the basic ones, the professional ones that handle in quality and quantity, then for consumers themselves. I think that is a role for everybody, for human health professionals, animal health professionals, environmentalists, to actually target these particular groups and conduct an educational sensitization campaign for them that will have messages that are designed particularly for that particular group. For example, the basic food producers, the nursing mothers and people that produce food for small communities. I think, and well, I would like to say, I'm not promising anything, but this is something we should also look at HIA, and it's a project we can actually look into like physical advocacy for proper hygiene for food producers. Then lastly, you mentioned the rules of environmental scientists that have waned because of the government impact or things, the situation of the country. Now you see how everything is linked. One health is not just human animal health and environmental health. It's also talking about things that external factors that affect the health of humans, animals, and the environment at large. So now if the situation of the country, the instability, insecurity, and whatever can affect a parasite of the government from enforcing the rules. And if it can come down to our health, then you can see how everything is linked. So that I also appreciate that because yeah, it induces the overall inclusive thinking that okay, everything is linked, and if one part is weak, the other part will definitely also be diseased. Thank you very much, sir, for the presentation. I really appreciate. Yeah, it's overwhelming. There was so much to learn. I'll hand over to the chief moderator now to proceed with the next point on the agenda. Thank you very much, sir.
You're welcome. It's a pleasure.
Thank you, Dr. Dauda. Thank you so much, Dr. Ibitoye, for your presentation. I really learned a lot. There was something you said. You said farmers need to pay more attention to not just operational biosecurity, but also structural. And that's very true. In fact, it doesn't have to be big in the scheme of little as maybe a woman keeping maybe 5 or 10 chickens in her backyard. Sometimes you discover that where the mini poultry is, it's not even far away from where they cook. So like they just go and come and just carry a lot of things along with them. So yes, a lot needs to be done, even in awareness and community level, the behaviors that predispose people to these foodborne zoonoses. We need to do a lot of awareness in that area. So thank you so much, Dr. Ibitoye, for your presentation. So now I think I can proceed to ask questions. Please, can you drop your questions in the chat box or raise your hands? If you can raise your hands, just use the emojis so that I can call on you to ask your questions, or if you prefer to drop it in the chat box as well, I can read it so that our chief speaker can respond to it.
All right, I can see Malik raising his hand. If you can allow him to unmute himself. Yeah.
Okay. Malik, okay.
Malik, you can unmute yourself. You didn't have that security level since there was. Let me try.
Okay, Malik, can you please unmute yourself so you can? Oh, okay, I think I can see a question in the chat box from Ibrahima. So it reads, the silence of veterinarians hindered operationalization of One Health. Let me come again. The silence of veterinarians hinders the operationalization of One Health. What to do for health pay? I think he's asking what professionals can do to become more.
Yeah. Can I respond?
Yes, please.
Yes.
You can respond.
Okay. I guess what is asking is that what veterinarians can do so that we can going forward forestall foodborne zoonoses among the community. Like I said in the course of the presentation, as vets, and now what we are doing here is one of the things we can do, creating awareness. Many people hear One Health. Many doesn't really know what it really entails. Many have not really taken their time to look into this approach holistically. What does it entail? So what we are doing here, webinars, seminars like this, we go a long way to enlighten and to educate people And as professionals, it will go a long way to let us know at what level, at what angle are we going to be coming in. So going forward, veterinarian, we should not be silent. I remember there was a time that when there was an outbreak of, I think, avian influenza in Nigeria some years back, and the human health professionals was about to hijack the whole preventive and control measure. Now, some big shots in vets said, no, we can't leave this thing to only you. There are areas you can't go into, there are areas you cannot handle. And we also, as well, there are areas we can't handle. So it has to be a collaborative effort of it. So going forward, veterinarians should not be silent. We should keep on doing more awareness of foodborne zoonoses, foodborne illnesses, and what are the various One Health approach we need to bring on board to safeguard our environment the more. And like we said in the course of the presentation, as veterinarians, we come in at the level of the farm and at the level of the abattoir, basically, most especially, except for those vets in epidemiologic field or those vets in preventive or whatever field that can be on the field handling community education and whatever. But basically, as a vet, we make sure that we safeguard the health of our animals. And if the health of animal is safeguarded from the farm where these animals are being produced, it will go a long way to forestall foodborne zoonosis challenges going forward. I don't know if I answered your question, Ibrahim. Thank you.
Okay, thank you, Dr. Ibitoye. Ibrahima, please let us know if your question was answered. I think another question has been sent. And it reads, Africa lacks traceability. How can we trace our animal foodstuff intended for human consumption? This is a very interesting question. So Dr. Ibitoye, please.
Yes, like we all know that in sub-Saharan Africa for now, food traceability is a challenge in the sense that many people bring animals to abattoir for slaughter, and many times you can't even trace back where these animals are coming from. For example, in Sokoto here, our metropolitan abattoir, sometimes animals come as far from Niger Republic. So food tracing issue in Nigeria is still a very issue, and in Africa generally, because many of our animals, it is difficult to trace them back to their various farms where they come from. Be that as it may, proper ante-mortem inspection of animals before slaughtering will go a long way to identify if such animals are harboring any of these zoonotic infection, and that will go a long way to remove such animal from the line of food production by vis-a-vis safeguarding the health of the populace. So if you can't for now trace our animal back to their various farms, now going forward, we should do all it takes to prevent any of these animals carrying any of these zoonotic infections from furnishing those pathogens into the environment. I think that is what we can do for now. And I believe as research and as experience become widens in Africa, we can begin to get our hands stronger on food traceability and what have you. And again, sometimes some food could be traced, but we have a lot of food traceability issues, more of those we cannot trace than those we can trace. Thank you.
Yeah. Thank you, Dr. Ibitoye. So there's another question. Adedoku Adeoye Davis says, or recommendations keep food nutritious and wholesome. A question from Mobolaji Abdulatif says, thank you very much for the presentation. From what I have learned so far, it seems we already got it wrong in Nigeria. Our abattoirs are located at our backyards. Do you think government policies can help reverse this situation, and how? Thank you. Another person, Yusuf Ibrahim, presentation, sir. Thanks for grooming us every now and then. May you remain blessed, sir. I would like to make we would get back to you on that. But let me still go back to the questions, Dr. Ibitoye. Adedokun David says that cooking food thoroughly might break down useful amino acids in food. Is there a temperature range or recommendations to keep food nutritious and wholesome at the same time? And Mobolaji Abdulatif says, from what I have learned so far, it seems we already got it wrong in Nigeria. Our abattoirs are located at our backyard. Do you think government policies can help reverse this situation?
Okay, thank you for the
how? Thank you. So, Dr. Ibito.
Sorry, just before you go, sir, let me mute the microphones that we're having at the.
Okay, please.
Yep. Okay. All right, please, you can proceed now, sir.
Oh, okay, thank you. Now, with regard to temperature range or recommendations to keep food nutritious and also without necessarily destroying the nutrients. While preparing for this seminar, I come across an article that has worked on that, but it's so enormous. It's not what I can just come and put down here. So different type of food, of course, are cooked at different temperature ranges. Now, you don't cook beef meat at the same temperature range you're going to cook fish. So I believe, yeah, these temperature ranges are different, but as recommended by researchers, I believe they have done their due diligences and recommending these temperatures for us will not destroy the nutrients in those food. Now, what I'm saying is that the temperature I gave in this seminar, above 70 degrees Celsius, or something thereabout, is preferably for poultry and for meat. For fish and for other food, I may not give the ranges now. But what I'm saying is that those ranges recommended by researchers, of course, have been worked upon and they have come to those conclusions. And I would suggest if Ayodokun need more material on that, I can get across to you that material that handled various types of food and temperature ranges within which they can be humanely cooked. Now, for the issue of, do you think the government policies can? Of course, you know, leadership is key in everything. When we get our leadership straight, then things begin to work well. Even as we have it now, most of our abattoirs in Nigeria initially are well sited, are well constructed, but due to collapse in government policy and management, these abattoirs, you know, became something else. It used to be like that in Sokoto for many years until we had Ministry of Animal Health and Fishery that came up strongly to put those abattoirs back in good shape. So government policy can go a long way, you know, in regulating the siting and the operation of our abattoirs, and doing this will go a long way to safeguard the health of the community. So yeah, I agree with Mobolaji that government policies can go, and that was why while talking about the players in One Health approach, I made mention of policy makers, I made mention of law enforcement agents, and these are the areas they also can come in and play their role in the One Health approach to safeguard the health of the people. Thank you. I don't know if I answered your question, Mubolaji and Adedokun.
Thank you, Dr. Ibitoye. Please, those that have asked questions so far, you can let us know if your questions have been answered to your satisfaction, or if you have any follow-up questions. So, Dr. Ibitoye, you have another question from Malik that reads, what can be the added value? Okay.
Yeah. Sorry, before you proceed, just on the last response you gave on the question
Dr.
from
Dowd, are you saying something?
Yes, yes. Can you hear me? Can you hear me?
Yes, please go on.
Okay, yeah. So on the question from Mobolaji, in the course of the presentation, he also mentioned that after these policies have been made, the veterinarians themselves, the human health professionals themselves, and the environmentalists, they have to be willing to be the boots on ground that will enforce these policies, right? Somebody mentioned operationalization of the One Health approach. So if you want to operationalize it, it's not for just one profession. Veterinarians would do, if, for example, veterinarians do their own job at the farm level and the abattoir level and during transportation of the food and everything, we need the human health professionals as well to come in and break the chain in case there is a failure along the line and a pathogen gets into circulation. They need to come to respond rapidly in terms of disease surveillance and diagnosis of whatever condition it is, and to work hand in hand with the veterinarians. They shouldn't think, somebody should mute them, Kenneth. So they shouldn't really think, okay, because they've diagnosed, just treat it. No, they should always do an absolute surveillance by tracing back to the origin of the food and where it came from, the potentials of the infection they're dealing with being zoonotic, and the potentials of that disease in particular spreading to other human beings and animals in the environment. So the government policies, yes, they will help, but we also need to be there to enforce these policies. Some of the policies will be made and they will implicate professionals, human health professionals, veterinarians, the environmentalists, but then are the human health veterinarians and the environmental, are they really playing their roles? The policies we are talking about, it's not as if somebody terminated them. Most of the public health policies in Nigeria are still active, right? But where are the people that will enforce it? Yeah, when you're talking about a situation like this, foodborne zoonosis, you don't expect police officers to come and, before you get to that level, you need professionals to actually do all they can to educate the people. It's when it gets extreme that you expect forceful implementation. But at this level, the professionals also have to be dutiful and responsible enough to play their own part in implementing the role. Yeah, thank you very much. I hope that was a useful addition.
Sure.
Yeah, thank you, Dr. Dauda. So let me go on with the questions. Dr. Ibitoye, Malik says, what can be the added value of the collaboration between the three disciplines when they intervene? Thank you, sir, for wonderful and educative presentation. Of course, this reminds me of the time three disciplines when they intervene in foodborne zoonosis.
Okay, although the line was breaking, but I can read the question from here. Can you hear me? Hello, can you hear me?
Yes, we can hear you, Doc.
Okay. Malik was asking that what can be the added value of the collaboration between the three disciplines when they intervene in the foodborne zoonosis. Now, when they intervene, added value will be something like the sharing of data. We share data coming from the farm, data coming from abattoir, data coming from education of food handlers and processors, the data coming from the environmentalists can be shared. And doing that, pulling those data together will help us to come out with a more robust approach in the line of One Health approach to better going forward prevent and control foodborne zoonosis, as the case may be. And for Hadi Ibrahim, say thank you for wonderful and okay. I think it's not asking any question.
No, he's not asking a question, sir.
Okay.
Yep.
Yeah, I don't know if that question was well answered, asked by Malik. Of course, there could be more. There could be more value, added value, but that is what I can think of for now. The shared data and those data could be put together, analyzed, and be used to come up with a more robust approach going forward to prevent foodborne zoonosis.
Yes, and basically, this is in fact the most important thing, to share data and to share information. For
Okay.
example, if Campylobacteriosis was diagnosed in human, for example, timely sharing of that information to the veterinarians close to that area, so that they can, tighten up biosecurity and take necessary measures to contain the situation, is something very, very important. So you see, information sharing is the most important of all the values that will be added. Although there will be an extension, for example, when you're conducting an outreach to educate the target group of people that have something to do with food processing, when you involve all the professionals, then you have a very robust messaging to pass out to the people, so they will understand comprehensively what roles they have to play to prevent or to break the chain of transmission of foodborne zoonosis. Thank you very much. Sorry, for the sake of time, the schedule was for 90 minutes. We would like to have that as the last question. I understand there is one more question, but we shared Dr. Ibitoye's email, so you can get your response. And we can also share the response to all the participants. And another question is coming in. I think I'll be forced to take this last two questions before
we have two questions.
Yeah.
2 questions.
So
I myself have a
let's
question.
Oh, yeah, we should do override, then yours should come first. But anyways, just let's have all the last questions
We
before
have,
we
yes.
continue. Yeah.
Yes. So Dr. Ibitoye, Malik says, can we also involve other of foodborne diseases, mainly linked to behavioral and traditional habits? And Oyetayo says, how can young veterinarians join the One Health community in order to facilitate more awareness to people?
Okay, let me answer Oyetayo's question. First, I think joining a webinar like this will further enlighten you. And I would recommend that is he or she should can contact our able doctor on the platform, Dr. Dauda, for more information.
Yep.
I recommend Oyetayo to please contact Dr. Dauda for more information on how to be part of One Health Initiative Approach community. Okay, sorry. My last question was asking, can we also involve other disciplines such as sociologists as the issue of foodborne diseases? I think as a case may be going forward, the player may get enlarged going forward. Like I said, there are others. Mainly we have the triad, the human professional, the human health professional, the animal health professional, and the ecologist. These are the major ones. But going forward, it can be enlarged. As a case, maybe you may come across a peculiar situation that will warrant the input of sociologists. Of course, you can bring them in. All what we are doing is that we want to safeguard the health of the people as well as that of the animal and the environment. So anything you can do within this sphere or within your power to really safeguard the health of the people, the animal, and the environment, will be welcome. So I believe the players are not exclusive for now. Going forward, it can be expanded to bring in more professionals. I so believe.
Wow, amazing. Thank you very much. Do you think okay, let me just drop my email here
Yes.
so you can
Thank you. Thank you. No, Dauda, go on. I think I can hear you talk.
all right, all right. So I just dropped my email. If you want to be involved, we have
Okay.
that will be the next thing on the agenda anyways. I was going to just inform
Yeah.
you guys we have another episode of One Scenarios coming up next month. It's gonna be on climate action and health equity. We have an initiative that arose from Uganda but got to the international level and it's been adopted in Germany now that we're coming to present. We have a tool also representing for climate actors and One Health advocates on how to teach people or how to establish projects that are related to climate action. So it will be an interesting one, just like this one. I mean, I enjoyed this so much. After the presentation, I'll be like, guy, you know nothing. Look at tons of information that we are getting today. Thank you very much, Dr. Ibitoye. I really appreciate the time you took to put the material together and taking your time out to really be present with us. I really appreciate. Thank you very much. God bless you. And I look forward to doing more and more with you, sir. Yeah, so we have an upcoming another one out scenarios episode coming up next month, and we are opening call for volunteers at our working group on climate action and working group on One Health education. You'll be seeing that on our social media platforms and our websites, and if you want to apply, you basically need to fill the volunteer form, and that's all. We're going to reach out to you, have a little discussion, and see where and when you can help us with the things we are doing moving forward. So thank you everyone for attending. I understand it's not easy. There is an election going on in the country, in Nigeria, and there is unrest and instability everywhere. Thank you for taking your time and your resources to really attend the meeting. We really appreciate your presence. I hope you've really learned something and it's worth your time and everything that you put into it. And yeah, this won't be the last. Yeah, there will be more and more. And for World Tuberculosis Day, we also have an event which you'll be seeing on our social media handles and our website as usual. But yeah, in all, I'm just trying to say I really appreciate the involvement of everyone. And yeah, it didn't go unnoticed. You will all, everybody that's present today will be getting the provided to all the people that are present in the meeting. So thank you. I believe I've taken the
Dr.
closing
Dauda,
remarks.
please don't forget our group pictures. Please, can
Oh,
everybody
definitely.
turn on their
So
videos?
our tradition, I was looking at time. Yeah, so you can turn on your videos, and what we do is at the end of every event, we turn on video and everybody says goodbye while we are taking screenshots. And yeah, so it's just a way to make it fun, right?
Please
Cindy,
turn on your videos.
yeah, you can turn on your videos. So we take a screenshot, the last man standing. Oh, boss. Thank you. Dr. Alimi is our Zoom host today. Yeah, he's having the call. Okay, is that all we've got? Can you all turn on your video, please? Fatima, Kuyet, yeah, if you can, please do. Yeah, thank you. It's so much appreciated. Valerie, I wish you a very good summit on Tuesday. The One Health Summit is coming up on Tuesday in Brussels. Yeah, and yeah, Valerie will be attending with one of our in-person tickets. Yeah, so thank you so much. Really appreciate. Yeah, so to avoid waste of time, yep, that's my email in the box. But then you can always look out for our announcements on our social media handles. We'll always make sure we do all we can to make sure our messages get to everyone. And this is also a push for you. Anybody around you that you can influence, even if it's just with the message of hygiene or something that they can do to contribute to augment the public health systems around them, please pass the message to them. It's not one person's job. It's not a day's job. It's going to take a long time, but we are at it and we are all out for it. And yeah, we are going to get there. Global health is possible and we will do it. Thank you. Bye-bye.
Thank you.
Thank you all.
Yeah.
Thank you for coming. Bye.
Bye-bye.